Case Study 3, Flash Flood by Kelly Barkdale. So, Case Study 3 involved a large flood in 2008 that caused damage and the closure of Columbus Regional Hospital, or CRH. All the patients had to be transported to other facilities, and they had to rebuild the hospital to repair damage. So the problem is, how are they going to keep their stakeholders informed? And the top priority is to create a communication plan for communicating with all the stakeholders. So first we have to identify the stakeholders. The key stakeholders are the doctors, staff, patients and their families, community members, and the nearby healthcare facilities. So first, we'll discuss the communication with the doctors. So it turns out in the case that some of the nearby facilities are trying to recruit the doctors from CRH. So I think it would be important to express understanding to those doctors if they choose to accept positions elsewhere, and also let them know that they can have their position back once CRH rebuilds, and that CRH is committed to still being the leader in healthcare. They also need to let the doctors know where their patients are and help them set up privileges at the facilities to treat their patients. They should all receive a personal phone call to let them know that they're important, and because patient information is private. The staff needs to be communicated with. That's anybody from nurses to janitors, IT, administrators. They need to notify them that they intend to pay them for at least 3 months. They need to notify them of their other responsibilities if they have work at other facilities set up for them, or if they need help with cleanup and fixing the building. They also need to let them know their commitment to, still employ them after the crisis. The notification for the pay commitment could be done through the media, because that's a broad amount of employees that need to be notified, and it's not specific. And then they can notify the specific job duties through a personal phone call. Patients and families need to be talked to. Need to notify patient families where their loved ones were taken. They can do this through the media to let the families know where to go to get this information, be it a hotline or another building. They also need to let the patients know that the physicians will be coming to see them, make sure they're getting the care that they would expect from CRH. This can be done through the news media or in person by the staff that comes to treat them. They need to let the patients know that CRH still cares about them and wants to make sure they're being properly cared for. Community members need to be updated of the progress and let them know their commitment to remain a healthcare leader and a large employer. They can communicate with the with the community members through the media. Alright, nearby healthcare facilities who took in all of these patients need to be notified of the patients, their care plan, their medical records, all of that. They also need to make sure that the facilities are able to handle the additional patients. They need to arrange for the doctor privileges at the facilities so that they can help take care of their own patients. And they need to arrange for additional staff that the facilities might need to help with the increased amount of patients. Communication methods. So primarily in this case, they would have used news media for public announcements and general information given to large amounts of people. They also use phone calls. This gives a personal touch, and they can give personal assignments or details that shouldn't be given to a large audience. Now, if this were to happen, I think you'd see a lot of it on social media. There'd be updates, videos, pictures of the damage, as well as progress being made throughout the rebuild. They'd be able to reach large amounts of people very quickly. And they can also use it to fundraise, as we've seen on things such as GoFundMe and such. During the whole process, I think it's important to maintain trust. The mission of CRH was to be the best in the country at everything we do. They show this commitment by paying their employees while they're out of work, allowing their physicians to treat patients at other facilities and help facilitate the treatment, letting families know where to meet to find out about loved ones, giving numbers for people to receive their prescriptions, letting patients know status of repairs, and letting the patients know where to seek treatment if needed. They also, show that they're committed to their employees, their patients, the community, and to being a leader when they open. They want to be the best at everything, and that includes rebuilding. So, in conclusion, the importance of communication in a crisis is probably the most important thing during the crisis. Bad communication can make a situation way worse. The community needs to be updated. They need to know where to get their services until the facility is rebuilt. They need to know what they can do. Employees need to know, do they need to find a new job? Are they going to be able to feed their families? It's all just very important. It's important to identify the key stakeholders so you know who you need to communicate with, and you can come up with how and what information they need. It's important to identify which communication methods are appropriate, knowing when you need to make a phone call versus when you need to just call the press. It's important to maintain trust so that when you reopen, you're still a strong member of the community and that people will come see you again. And you also want to keep your strong reputation intact. I mean, when you work hard to be the best and to have a good reputation in the community, you don't want a crisis to ruin that and your handling of the crisis.